Welcome back to Takacs McGinnis Elder Code Law Hour. I'm Tim Takacs, and in today's show we're talking about getting organized and spring cleaning.
And I'm Barbara McGinnis. What happens when your loved one has moved beyond just being disorganized or living in a cluttered lifestyle? What if they're a hoarder? Well, with us in this segment is an expert, Marnie Matthews, who's a licensed clinical social worker, and she's going to talk to us about how to identify that and how to manage that. Welcome, Marnie. Good morning.
Good morning. Thank you for having me.
So sometimes we joke about our parents who love their things be a hoarder, but what's the real clinical definition of a hoarder?
That's a very good question, because with the existence of TV shows, the shows Hoarders and Hoarding Buried Alive, it is that people can say, oh, look, you've got too much stuff, you're a hoarder. The actual clinical definition is somebody that has extreme difficulty or the inability to let things go. So when we see people with a lot of clutter, we think, oh, that they're a hoarder, they have hoarding issues. But the level of clutter doesn't always mean that somebody meets criteria for the mental health issue of hoarding disorder. It's just that extreme attachment and the inability to let things go, and then things build up to a point with nothing leaving the home that the house becomes unusable.
So it's either maybe a psychological thing, or maybe it could be a disease or something, you know,
right,
where it could go to that level, perhaps.
Yes. So there is a psychological disorder, mental health disorder called hoarding disorder that can be diagnosed. There's also hoarding behavior, and the two can get confused easily. So hoarding disorder is the mental health issue, again with the extreme attachments. But we always have to rule out, is the hoarding behavior, is the fact that somebody's holding on to things due to some other issue, like a medical issue. So people with dementia maybe start having hoarding behavior, people with a traumatic brain injury. So if the hoarding behavior is sudden onset, like starts like, wait, this didn't used to happen, then we're likely looking at hoarding behavior. And hoarding behavior can also come from other mental health issues. Some people might have OCD that requires a lot of work for them and processes to get things out of the house, so things build up. Or they might struggle with depression and have difficulty letting go. But when these symptoms of the other mental health issue are alleviated, like depression, anxiety, OCD, or ADHD, then they're able to get rid of things. And therefore we call it hoarding behavior, not hoarding disorder, because the disorder is chronic and progressive. So
your task, I guess, initially is to make distinctions between, is this just like clutter, or maybe, you know, so essentially you're doing a diagnosis. You know, you're taking a patient history, I guess, in a way, and determining, is this sudden, you know, was there a trauma, or was there something else that caused this, you know, and then devising a solution, which could be therapeutic or,
yes,
or not.
Yes, absolutely. And a couple good points on that. Sometimes when I work with people, I find that it's not important to figure out if it's hoarding disorder or if it's clutter or hoarding behavior. I might know by looking at it and talking to the person, but a lot of people in those situations, especially because what the TV shows, of course, we wouldn't have the awareness we have today without the TV shows, but a lot of people are ashamed and they're embarrassed of the situation. They're afraid of judgment. They're afraid people are going to take their things, so they don't want to be labeled, you know, having hoarding issues. So going in, that might not be my primary goal. The goal is to start making the home safe and functional for them again. But at the same time, there is a big difference. So a lot of people ask, what's the difference between clutter and hoarding? If it's clutter, people can usually clean it up in 30 minutes to 45 minutes and put things away enough for people to come over. If it's hoarding, people are going to have a lot more difficult time doing that because they're attached to items. There's other mental health issues going on. There's attention issues. There's difficulty in making decisions. So somebody with hoarding disorder will likely tell you, you don't need to help me, I got it, I can do it myself. And they're honestly telling the truth and believe that they can, but they're not understanding their own, what we call psychopathology. They're not understanding that there's a lot of barriers to doing that without getting proper health and proper treatment.
Wow, this sounds like, I mean, just talking about it's even a little overwhelming. There's so much to think about.
Yes.
And one thing I was thinking about is, what about collectors versus hoarders? I guess it's the level of safety.
That's a good question too. So I get a lot of people that say that they're collectors. And a side note on that, when we're working with people with hoarding issues, if they're referring to their stuff as a collection, we do the same. So I'm not going to challenge them on that. Okay. However, the difference between a collector and somebody with hoarding issues is a collector is going to be very specific about what they collect. They're also going to intentionally collect things, and they're also going to keep the items in a way that signifies the importance or the value of that item. Somebody with hoarding issues is going to collect anything and everything in any way.
So accumulate.
Exactly. So there's not going to be a theme. There's not going to be the value placed on that item.
No, and they're not necessarily things that are sentimental. I mean, everything maybe becomes sentimental. It's not just the pictures in the photo albums. It's trash.
Right. So people with hoarding disorder are attached for three reasons, like all of us are.
Okay.
There's the sentimental, which we all keep things we don't need necessarily because of sentimental reasons. There's an instrumental attachment, which means it can be fixed, it can be worn again, somebody else can use it at some point. And then there's the intrinsic value. We just like how things look. And so we can all make judgments on other people's stuff and say, well, that's not right, but yet we wouldn't want our things taken or judged.
Like
exactly.
So hoarding is a pathology, I guess, and it's, I guess, what I'm hearing you say. I mean, true hoarding.
Yes.
The hoarding disorder and the hoarding behavior, maybe, which is a manifestation of that. So if a loved one or someone you know is a hoarder, you know, how should we help them?
So the important thing with working with hoarding issues, whether it's hoarding behavior, hoarding disorder, is to understand that it is a mental health issue. It's hard to understand that sometimes because the solution for somebody who doesn't struggle with it seems so simple. It's like, just pick it up.
Just clean up your stuff.
Right. And it's not that simple. So being able to remove yourself from dealing with the person's personal items and use an approach that we call the harm reduction approach. And we suggest that if you're a family member, if you're a professional working with a person, if you're just a friend or a therapist, to be able to approach somebody initially working with the harm reduction approach. And what that means is, instead of going in and saying, you know, your door, I can't even get open and all the junk's there and there's dog food back there and the dog hasn't been here for years and you need to get rid of these things, we would go in and say, I noticed that when I came in the front door I can't open it all the way and I'm really concerned for your safety. How can I help you make it safe? And we work in that process so that we're doing things. We have a form called the Uniform Inspection Checklist that I developed several years ago that's used throughout the US, Canada, and Australia to manage hoarding cases. It's based on the harm reduction approach and it walks people through. You have to have egresses, you have to have pathways, and that goes for anybody, even if you're not in a hoarded home. So it really kind of levels the playing field and takes that mental health aspect off, because while it's important to get mental health help, and especially if we're talking about families trying to help their family member, that's not usually what the person with the hoarding issue wants to hear, because they don't really see that they have a mental health issue. They just have too much stuff.
What about people that are, say, class hoarders, we'll call them, if they move to assisted living or must move? What do we do? What do you do then? They, obviously, I'm going to assume they want to take all that stuff with them.
Right. So it's a very tough situation, and that's when we call people like who you had earlier, like Tina, to help with that. So we do it kind of from two aspects. As a therapist, I would go in and help with the mental health piece about downsizing and attachment and letting go. And somebody like a professional organizer that has experience with people that struggle with this would help them in making the determination on what to take and what not to take. But that also leads into the question of where other families want to go in and clean the person's home out for them, or just do a full clean out. We recommend that those are never done, but sometimes we know they have to be done, like a full clean out. What happens though when you do that is, you mentioned before about hoarding is triggered by trauma and loss. So if you go take all their stuff out and they're not involved, you've caused a trauma and a loss, which is going to make it worse. And then also they don't know how to manage the new space, because they don't have the skills and strategies that have to go along with that. And then the behavior modification, which is what we do, the cognitive behavioral therapy, to help them get through it.
Is that the best treatment approach, the cognitive therapy?
Yes, the cognitive behavioral therapy is the best approach. The work happens, it can happen in the home, so I do work in people's home, or also in an office. I work out of the Nashville OCD and Anxiety Treatment Center in Brentwood, and so we do work in their offices too.
So guess what? We're putting your contact information up here. So we're just got a few seconds left.
Oh, I like the title, thecluttermovement.com. And so that's where someone would call, and you would start with helping them find out if this is really a hoarding situation or if it's just clutter.
Exactly, and in that involving too, we always do the risk assessment. So is somebody about to get evicted from their home? Are they about to, you know, needing to move, and how do we need to address it? Yes.
Absolutely, great.
Well, we sure do appreciate you being here today. It's very fascinating.
And I'm Tim Takacs, so we just got a few seconds left. For more information about the organizations and resources that we've talked about in today's show, please visit our website, tn-elderlaw.com, and click on the News Hour tab, and you'll see a lot of information about this and other segments and other shows that we've done. Thanks for staying with us, and we'll see you next time.